Hello, everybody. Welcome to lesson 11 from the Medical Care Organizations course. So we're actually moving through this quite fast. Well, actually, I'm moving through this quite fast. You guys are going at whatever pace you guys are going at. Okay, so at this point, we're somewhat close to the end, especially given that the last couple of chapters are going to be very, very small. Okay, so just minimal information. Hopefully we can get through this quick and I won't even have to take up too much of your time. I know I say that a lot, but I mean it. So this lesson is going to be all about health risks of our more special populations. Okay, so there are certain population groups that are at greater risk of having poor health. Okay, and it could be poor health in poor physical health, poor psychological health, or poor social health. Also poor emotional and spiritual health and whatnot, but we focus more on these other ones. So there certain population groups have greater risk of these poor health, right? So some terms that we use to that we're going to use to, or that you'll hear in life, that people use to describe these groups would be underserved, medically disadvantaged, underprivileged. I personally, being out in the world, like I hear underprivileged a lot and then underserved. Okay, so that's used quite a bit. The other one's not so much, but those are still terms that can be used to really describe these different groups. Okay, so who are these special population groups that are at greater risk of poor health? They would be children in general, okay, but also more specifically uninsured children, okay, and then women, rural area residents, people who live out in the rural areas, the homeless, the mentally ill, the chronically ill, the disabled, and those who have HIV/AIDS. So who are the uninsured? The uninsured tend to be less educated, more economically disadvantaged. They usually either work like part-time jobs, no job, or they might be employed by like a small business, like a small mom-and-pop type business that isn't going to have health insurance. And then they also might be self-employed, okay, or maybe they're working for cash, okay, they might be undocumented, like that, okay. And so medically uninsured people are usually employed, okay, usually they are employed, but they're just not covered, and it's because maybe their employer doesn't offer health insurance, maybe the employee doesn't qualify to receive health insurance from that employer because maybe they're part-time, okay, maybe they could be self-employed and they can't afford their own health insurance. Okay, so, all right, moving forward, then we have women. So women are especially very important. First of all, we're like half of the country. Okay. Next, women are the leading providers of, in the nursing profession, also in a lot of allopathic and osteopathic medicine. So we have many women physicians, dentists, podiatrists, optometrists, and whatnot. So we are leading providers in healthcare, as well as we tend to live longer than men, but we also tend to suffer more morbidities, more sicknesses than men do. Okay, so typically we will live longer than men, but we'll have chronic illnesses longer than men as well. So we'll just be we'll be suffering from chronic illnesses a lot longer. Okay, and we tend to have poorer health outcomes. Women, like so some things just to keep in, I don't know, just to put things into perspective. So women are considered medically disadvantaged because there are a lot of medical issues that we may be at greater risk of. Okay, so first of all, heart disease and stroke. Women account for a higher percentage of deaths there are a higher percentage of deaths among women than men at all stages of life, okay? And then 42% of women with heart attacks, okay, die in that same year. Whereas men will typically, only 24% of men will die in that same year when they have a heart attack. So that's already like pretty astounding. Women will account for approximately half of the HIV and AIDS cases worldwide, which is probably expected. Women are more likely to be more depressed than men, which a lot of people probably already guessed that. But yes, women usually have a lot more going on emotionally and hormonally. So yeah, they tend to be more depressed than men. Women are substantially also at greater risk for having Alzheimer's than men. Okay, so women are the principal users of the healthcare system. So generally what we see is that women usually are like the family coordinator. Okay, so women are the ones who will schedule the doctor appointments for everyone in the family, including themselves, and women are the ones who like make, things happen, run, the household in that way. So, and then until the age group 65 and older, women usually have a higher physician utilization rates than men. So they go to see the physician regularly, a lot more often than the men do. And also have, so usually the idea behind that is that women usually tend to be like, okay, well, I think there's something wrong. I better go see a physician. Let's get this fixed. And then men tend to not want to do that. They might want to tough it out and be like, I can handle it. It's not a problem. Anyway, so women also suffer a lot more than men because women tend to have more part-time jobs than men. Men usually have full-time. Women typically, we'll see a lot of women having more part-time jobs and making less money and having a lot more interruptions in their jobs as well. So they might have typically interruptions like having to do with family and whatnot. Maybe they're, they might have to take maternity leave. They might have to even just get off work sometime because they're having their child is sick or things like that. So women tend to have more interruptions in their work as well. And they are at higher risk of being uninsured. They're also more likely to be dependent on their husband's health insurance plan or have Medicaid. Okay. So the Office on Women's Health, or the OWH, is this huge organization that puts out a lot of interventions and a lot of projects to help women. Okay, they focus on a lot of reasons why women are more disadvantaged, and they try to target those and create programs that help women and help them not be so vulnerable to a lot of these health risks. So some of the things that they have done was they are responsible for implementing the National Action Plan on Breast Cancer. So right here, this has been a major public-private partnership dedicated to improving the diagnosis, the treatment, prevention of breast cancer through research, service delivery, and education. So what a huge thing that they have been doing is they'll have like free mammograms and whatnot for women. They'll sponsor free for women to have like free mammograms and to check all that. And another thing that they do is they do help to prevent a lot of physical and sexual abuse in women. So they have started programs to help those women who may have suffered from any kind of domestic abuse and things like that. In addition, they also help a lot of women who suffer from like drug and alcohol abuse as well. Okay, so children. Most children actually are covered under some sort of health insurance. There are few that are uninsured. So about maybe half, or probably less than half, because many of this isn't even documented, but probably roughly half-ish might have private health insurance under their parents' work health insurance. And then we have about 38 or so percent. It's probably a little bit less because a lot of this isn't reported, but you have many children who are receiving Medicaid or some sort of public insurance. Okay, so then that leaves just a small fraction of the population of children who go uninsured. Now, about 5 to 20% of children actually have have disabilities. So, and another thing that we need to take into just be mindful of is that today a lot of children do not suffer from a lot of the morbidities and things like that that they were suffering from in the past. Today we have new morbidities that we have to worry about among the children. Okay, so today some problems that we do have that they are vulnerable to, very vulnerable to, would be drug and alcohol abuse, violence, emotional disorders, and also learning problems. Okay, it's not saying that this stuff didn't exist in the past, but it's just more prevalent now, and I'm not sure if that means it's because we're finally paying attention to it, or if that means there's just a lot of influence now, and it's kind of, there's a lot of influence and a lot of other, factors that are leading children down this other, dark path. So next, let's look at the rural health. Okay, so we've talked about how the rural communities have poor access to health, and a lot of this is due to poverty, but also a lot of it is going to be due to the fact that there are really long distances from going from your home to like the nearest clinic or the nearest, private practice or the nearest hospital or anything like that. And it's not like over here where there's kind of a hospital like within every, 10 miles or so, there's a hospital, at least one. Okay. So in many rural areas, it's very hard to get access to medicine. Okay, of course, there's a lot of poverty, there's a lot of, there's lack of transportation to even get to these places. And in many cases, we don't have very many facilities in rural areas. Okay, there aren't as many as there are over here. So, and, a large reason for that is because many physicians and health professionals do not necessarily want to move to a rural area. And we've already went over the reasons for why that is. So let's not get into that, but there are many reasons why they have terribly poor access in rural areas. So the government has stepped in and created certain measures, certain practices, and programs to help the rural areas, okay, rural healthcare. So here is a list of some things that the government has done. So I'm going to go ahead and invite you to look at a couple of these, or just go ahead and look at them or whatever ones you're interested in. But for now, what we're going to do is we're going to just get into a couple. I'm going to highlight a few of those measures. So one thing that they have done is they created the National Health Service Corps. And this was created in 1970. And really what this is the whole point of this is to retain and recruit and retain physicians and also nurses and other healthcare practitioners into these rural areas. Okay, and get them to practice, medicine and for the people that live locally there. Okay, so what they've used as like an incentive to recruit and retain these physicians and health practitioners is they've created scholarship programs and loan repayment programs, okay, for them. So they targeted doctors, dentists, nurse practitioners, midwives, mental health professionals, and whatnot, and said, okay, here's your contract. You serve so many years, a minimum of 2 years in these areas, and then your loan will be repaid, or you will earn a scholarship to go to get medical school or whatever you're doing. So, and this has been going on for the last 40 years, or 50 years actually. Okay, so another thing that has been done to help the healthcare in the rural communities. So we have community and migrant health centers. Are you guys familiar with what migrant farm workers are? So many of these people, they migrate. Okay, so they sort of move around. They don't necessarily stay in one place, but they're there, and they usually pick up jobs working on farms and whatnot in the rural areas. So, and a lot of these people are not even documented. So there's a lot of like stigma and a lot of fear about whenever these people need healthcare services, many of them don't always go get healthcare services. Okay, there's a lot of fear there that they could get in trouble, they could get deported, they could get caught, I don't know, things like that. So, and many of these people are, of course, low income and things like that. So what the government has done is they created migrant health centers. Okay, and these are, they also move around, with wherever the people are going, and they're there to provide a lot of primary and preventative care. It's really hard to get physicians, okay, to practice and to be part of this, but they're able to get some, healthcare professionals to help these people and, provide primary and preventative care, and also prenatal care as well, which is much needed because many of these people, like the new mothers and whatnot, they are not receiving any kind of prenatal care whatsoever. Okay, which is risky. So, this is there as a resource to hopefully help them out and keep them healthy. So here is another thing that the government allowed for the rural areas, the rural practitioners and clinics and whatnot. So because remember how the whole shift happened, and a lot of these areas, especially the rural areas, were very affected. They couldn't really keep up. And they can't even, not only can they not really keep up, they can't even necessarily pay a physician appropriately, okay, to work in their clinics and their hospitals and whatnot. So what the government did say was that you guys can go ahead and fill your clinics and your hospitals up with midwives and physician assistants, nurse practitioners and whatnot, and you don't need to have a physician there present. So a physician will not need to supervise these rural communities. Okay, so they're allowed to just have it ran by just the nurse practitioners or the non-physician practitioners. Okay, remember we already talked about how they already know how, they pretty much do everything a generalist can do anyway. So they're allowed to have non-physician practitioners instead of an actual physician, and allow them to operate that way. Now there are certain criteria that they have to pass in order to be allowed to be part of this program, but it's there and it helps out a lot. Okay, now we're going to look at the homeless. So there is an estimated 3.5 million people who are homeless. Okay, those are a lot of homeless people in this country. Majority are going to be single men. About 17% are single women. About 33% are families with children, and then 39%, okay, almost as much as single men, are children who are under the age of 18, which is pretty shocking, okay? Anyway, so homeless adults and children have a high prevalence of untreated acute and chronic medical and mental health and substance abuse problems as well. Okay, so they're at major risk of assault, victimization, of being injured, of having any kind of medical, chronic, especially acute, since they're out there bracing the elements. Okay, they're at risk of having so many health problems. Okay, so there are measures out there that are there to help, but there are a lot of barriers for them to receive health care for the homeless population. Okay, so of course there are high hospitalization rates among the homeless population, but what happens when, and yeah, like the hospital will definitely stabilize them when they go for whatever, okay, because the ER has to care for you whether or not you have an ability to pay. But the hospital would just stabilize them and then send them on their way. So they're just back out on the street. So if they're injured, they have to deal with that injury out there, okay? Because the hospital is only going to fix them up real quick and then send them out. And then there are also barriers to ambulatory services like outpatient services and things like that they need because they have no insurance. Okay, if there is no insurance and there's no way to pay for other ambulatory services, really the only health care that they can receive is through the ER. That's their only their only portal through the healthcare system, and the healthcare system is not going to really move them around and help them out too much. Really, the hospital is just going to, like I said, they're going to fix them up or they're going to stabilize them and send them on their way. So they're at terrible risk, and it's really difficult, especially if they have something that they come into the hospital for. It's really hard for them to recover or to, move past that, because of their situation. Okay, so there are, programs out there that are meant to help and provide some support to the homeless population. So there are outreach shelters, hotels where you can get like a government waiver to stay in a hotel sometimes, and that, it's nice to have some privacy, a comfortable bed, and then be able to like take a shower and things like that. So there are hotels that will accept certain waivers. There are soup lines, parks and bus stations where they can find some sort of shelter, which isn't going to help too much, but and then the Salvation Army, and we have other organizations out there as well who like to provide, social support, maybe some rehab sometimes, and then of course food, housing, and clothing as well. So now let's look at mental health. So those who have mental health issues, and this typically about 25% of our nation has a mental health issue, but this is probably it's probably actually a lot higher because most people don't go get help. A lot of mental health problems that are prevalent in our society, they just go and report it, so we don't really know that they're there. But anyway, so at least 1 in every 4 Americans will have a mental disorder any given year. Okay. Now, depression is the most common illness among primary care patients, and it affects approximately 14.8 million adults in the United States. So here is a list of many risk factors, okay, that are associated with developing depression in adults. Okay. You can go ahead and read that on your own. Also, I want to say that managed care is also kind of expanding into mental health. Many managed care organizations have actually tried to create mental health programs and maybe build contracts with different mental health practitioners. The state and local government also want to contract with a lot of Medicare organizations to handle a lot of the mental health and substance abuse services that are covered by Medicaid, because usually Medicaid programs in most of these states, they like to give people their benefits through some sort of managed care organization, because they know that managed care is very strict and they work on utilization control and all of that. So usually if you are qualified to receive Medicaid and you're a Medicaid beneficiary, you're going to receive your benefits as like a managed care through a managed care organization, most likely an HMO. And so that is why the state and local government has been trying to work with a lot of managed care organizations so that they can come up with more controlled programs for mental health, okay, for their Medicaid recipients. Okay, so now the chronically ill and disabled. So this demographic presents challenges to our healthcare system that is oriented towards acute care. And this is because many people who have chronic diseases, although they can be very well maintained, chronic diseases, many times you're going to have some sort of flare or just something will come up and will allow our chronic diseases to get worse, and we'll have an acute episode. Okay, so and that's just a result of how our healthcare system works. Okay, because we're not as focused on preventative medicine or primary care and then really maintaining our chronic illnesses when we have them. So usually a chronic illness at some point, it's going to flare up, it's going to turn into an acute care episode, and then it's going to be really expensive care. Okay. So chronic disease accounts for 75% of the total medical care expenditure in the United States. So a lot of our money is going straight to these chronic diseases, while it probably doesn't have to be as high if we would focus more on preventative and primary health care. Okay, so chronic illness is a disease or injury with long-term symptoms, 3 or more months, or it could just be like a lifetime. Okay, it could just be something that you have to maintain for the rest of your life. So a disability is a person's short-term or long-term limitation or inability to perform tasks that were previously done unaided. Okay, so much of many chronically ill people will eventually become disabled at some point. And it's kind of a result of how our system is. We don't focus on the right things. So then we have HIV/AIDS. So in July of 1982, a disease was officially named acquired immunodeficiency syndrome, or AIDS, right? AIDS is caused by human immunodeficiency virus known as HIV, right? And mostly what AIDS does, I think it's common knowledge now, is a lot of what AIDS is going to do is it really deteriorates your immune system, okay? And it makes you so vulnerable to anything, okay? Like a cold can kill you, whereas a cold for a healthy individual, it's not going to do anything. So the treatments that we have been to slow the progression of the virus and any kind of opportunistic infections that might affect the patient because they are immunocompromised. So what we've done is we've created these antiretroviral therapies, and that has been amazing for people who have HIV or AIDS, because that does slow the progression, okay? And it makes it more of like a chronic illness, and you don't have to, so you can treat it as a chronic illness, and you can just maintain yourself, maintain your life, and you can still live a full life, and it doesn't allow as many, things to affect you. A lot of these diseases and whatnot that normally hit your immune system hard and get you really, really sick. We got to a point where we can use these therapies and we don't necessarily have to even go down that road. So anyway, the course of AIDS is a very gradual decline in the patient's physical, cognitive, and emotional function and well-being. But we have been able to slow that very much. Okay, so medical care is super expensive for AIDS and HIV patients. You're probably going to end up costing roughly, close to $400,000 in treatments over the course of your lifetime. Okay, Medicaid is the primary payer. Usually many people who will have this disease might, they'll get to a point where they're just like, okay, Medicaid has to pay for all this because it's too expensive. So they'll put them in situations where they are definitely going to be able to qualify for Medicaid. Okay. All right, let's move forward.